Good afternoon, and welcome to Journalism in the Time of Crisis Symposium, organized by Carleton University here in Ottawa. My name is Matthew Pearson. I am an assistant professor of journalism, and I will be moderating today's panel on COVID-19 and mental health. Joining me today are Dr. Anthony Feinstein, a neuropsychiatrist and professor of psychiatry at the University of Toronto, Jane Seid, a reporter for British Columbia's North Shore News, Jad Sharour, a communications officer with Lebanon's Samir Kassir Foundation, and lastly, we're just waiting for her to join us, but Kiran Nazish, the founding director of the Coalition for Women in Journalism. She'll be with us shortly. I'd like to begin by acknowledging that Carleton University is located on the unceded, unsurrendered, and traditional territory of the Algonquin First Nation. And we owe it to them to respect this land, its stories, and its keepers. We all benefit greatly from the freedom and opportunity we are able to enjoy on this land. Here's how today's panel is going to work. I'm going to introduce each guest and ask them to make a few opening remarks. Then I'll pose some questions, and hopefully we'll get some discussion going. And then it's your turn. Please take this opportunity to ask whatever's on your mind, and we'll try to get in as many questions as we can. So let's get started. Dr. Anthony Feinstein is a leading voice on how journalists are affected when they report on extreme events, such as the 9/11 terror attacks and the Iraq War. He is the author of several books, including Journalists Under Fire: The Psychological Hazards of Covering War. In 2012, he produced a documentary called Under Fire, which was the winner of a Peabody Award in 2012. He joins us from Toronto. Dr. Feinstein, welcome.
Yes, hi, Matt, thank you.
Please go ahead with your opening comments.
Good, thank you. So at the height of the pandemic, back in April, I was approached by a group at Oxford University, the Reuters Institute for the Study of Journalism, a colleague of mine, Mira Silva. She approached and said, would you be able to undertake a study looking at how journalists were being affected by the pandemic? And because we have a well-established methodology of getting journalism research done, we were able to do this quite quickly. I'm pleased to report that our university moved with lightning speed in terms of getting ethics approval. There's a real sense of urgency with respect to the COVID pandemic to cut through all the bureaucracy and get things done quickly. And so we got ethics permission very quickly. We established a methodology. 2 large journalism organizations wanted to be part of the study. They opened up their Rolodex of names of journalists to us, and we were able to contact them the way we've done with numerous studies in the past through a dedicated website devoted to the study. We approached 130 journalists. The response rate was extremely strong. Close to 70% of journalists replied and wanted to take part in the study. To put that into a social science context, to get this kind of response rate is really quite remarkable, because the typical response rate from internet type surveys is around about 30% or less. So we've got a response rate here of close to 70%, which said that journalists wanted to share their thoughts with us. We looked at symptoms of anxiety and depression and post-traumatic stress disorder. And we also captured some basic demographic details and how their work as journalists had been affected by the pandemic. I'll give you a summary of what the results show. About 55% of our sample were women, which is once again somewhat unusual for our studies, where when we've looked at conflict zones and war zones, the majority of journalists have been men. Here we've got a slight majority of women. The average age was in their 40s. What's interesting is that over 50% of the journalists were working almost exclusively on COVID-related stories, even though they were not health journalists to begin with. Their portfolio had not been to focus on health-related stuff. Because the story is so big, they had been given this portfolio of news stories. We found that news organizations were asking younger journalists to do the COVID work, which was interesting. We think that news managers were aware of the increased risks that come with age when you get close to the virus. We know now that elderly people are more vulnerable to the effects of the virus. And it seems as though, this is my interpretation of it, that news managers asked the younger journalists to do the frontline work, as it were, when it came to covering the COVID story, which was interesting. We also saw, this I think was really quite remarkable, that over 50% of the journalists had accepted counseling. They were offered help by the news organizations and they had accepted counseling, which I think is a quantum shift for the industry to see so many journalists accepting psychological help, which was being offered by management. And I'll show you why this was important. When it came to looking at their psychological results, we found that the rate of clinically significant anxiety was 25%. That's very high. You know, this was what we call a point prevalence. At a moment in time, the rate of anxiety was 25%. When you look at data pre-pandemic, you see that rates of anxiety over the course of a lifetime do not even approach 20%. So here we've got a snapshot of a moment in time where the prevalence rate is 25% for anxiety. For depression, it was 20%. Once again, very high relative to what it was pre-pandemic. We found much lower rates of PTSD, but even there, the rate was elevated compared to what it had been pre-pandemic. We showed that the journalists who were covering the pandemic were more likely to be anxious or psychologically distressed or show symptoms of PTSD. And because these journalists were more likely to be young, we saw higher rates of psychological distress in younger journalists. And this is unusual. When we look at our data sets accumulated over 20 years of research, we see that distress often goes up with age. Here we're seeing something different, that the younger journalists were showing more distress, and that's because they were in the front lines covering the story. What we did show, this is good news, is that those journalists who had taken advantage of therapy offered to them were significantly less anxious or depressed, and had significantly fewer symptoms of PTSD. And so no surprise, guys, therapy helps. It works. This is what I've been doing my entire life, but we've got some objective evidence in real time to show that those journalists who accepted the therapy that was on offer did much better psychologically than those who are not getting therapy. A couple other interesting findings. Journalists reported that their workload had increased following the pandemic. There were many more stories to recover, and they felt stressed by this increase in workload. Final, I think, reasonable good news is that we asked journalists to rate what they saw as the news organization's openness to helping them. You know, how supportive was your news organization during the pandemic? We gave them a simple analog scale, 0 being no support, 10 being, very supportive. And the score was 6, which is not bad. I mean, journalists, for the most part, saw their organizations as helpful to them. And in particular, they took advantage of the psychological therapy that was offered to them to good effect, which helped with their anxiety and depression. So Matt, you asked me to speak for about 5 to 6 minutes. I think I've used up my time slot. I'll be happy to come back and talk more about the data later.
That's beautiful, Dr. Feinstein. Thank you. And just quickly, you mentioned that 2 news organizations were eager to participate. Were those, what country were those news organizations in?
So they were international. They've got bureaus all over the show. One is predominantly based in England, and the other one in France.
Okay.
But they are international, and they have their journalists scattered to the 4 corners of the world. And so responses came back from Canada, the United States, continental Europe, and Asia.
Okay, very good. Thank you for that. We look forward to digging into more of that research. And I think what I will do at some point is share a link to the Reuters piece about that study that delved into some of those numbers. We're going to go next to Jane Side in all the way out in beautiful British Columbia. For more than 15 years, Jane Side has been a reporter for the North Shore News, which serves the communities of North Vancouver and West Vancouver. She reports on a wide range of topics, including courts, crime, local politics, education, as well as mountain rescues, because she's in British Columbia, and the occasional bear sightings when bears wander into her community. Jane's frontline reporting on COVID-19 includes numerous stories about the Lynn Valley Care Centre, where Canada's first COVID-19 death was recorded on March 8th. In all, at least 20 residents from the home have died as a result of COVID-19. I'm very pleased to welcome Jane here. She joins us from the Sunshine Coast. Hello, Jane.
Hello. Yeah, I'm a reporter with the North Shore News. We are a suburban community on the North Shore of Burrard Inlet. So we're in the Greater Vancouver area in British Columbia, and it's a quite an affluent community. I'm a general reporter, so my usual beats cover things like courts and crime and education and politics and traffic congestion and housing prices and a whole range of sort of general issues. Pre-pandemic, I was not a health reporter. I was not a science reporter. I would go to court, I would do interviews, I would go to press conferences. So it was a very different scenario leading up to COVID. Back in February, we started to hear a little bit about COVID in our community. There wasn't a lot of news, but we have a number of residents in our communities in North and West Vancouver who are either immigrants or who have ties to family members in other countries, such as mainland China and Iran. And we began hearing little bits of information from those communities. For instance, parents who usually organize a Lunar New Year event at their school. They were suddenly canceling those, even though they weren't being told to. We started hearing about Nowruz festivities, the Iranian New Year festivities that usually go on, and they're usually quite a big deal on the North Shore. Organizers were starting to talk about canceling those. So we began to get a feeling that something different was going on here. One interesting tidbit is that it was actually, I believe, through the cases that began to pop up in British Columbia from travelers who had come back from Iran, that authorities at the World Health Organization began to understand that the numbers in Iran were quite different from what the official sources had been talking about, because there were so many of them popping up that doing the numbers, extrapolating backwards, it just wasn't reasonable that the numbers that officially were given were accurate. And that actually did end up being true, that there were far more numbers than they had originally thought. I think the first week of March was a real tipping point. That was when we first heard that they had COVID in a North Vancouver seniors home, the Lynn Valley Care Center, which is a private care center, but it's supported, like most of them, with government funding. So there's a mix of private and public beds in that facility. Very shortly afterwards, a few days later, we learned that the first person in Canada to die of COVID was a man who had been living at the seniors home. He was a frail man in his 80s. And a couple of days later, I found myself speaking to his daughter about that experience. And she was describing to me about being told that her father was dying and being allowed to go in, but basically having to gown up in the full PPE, sort of like a hazmat suit kind of scenario, and sort of go in to his room and say goodbye to him in that way. And it seemed like something out of a science fiction story. This wasn't something that we'd seen before. Of course, after that, the stories were to get much worse. 20 people in that first nursing home did end up dying of COVID, and it spread to other nursing homes, as we know. But at the time, we didn't really know what was going to happen. We knew that they were setting up tents outside the local hospital, sort of to triage and assess people for COVID. We knew that there was a COVID ward, a new COVID ward being set up at our local hospital, which was one of the first hospitals in the province to take in COVID patients into a specialized ward. But that was when I became a COVID reporter. So the pandemic changed what we were writing about very significantly in a very short period of time. And it also changed how we were reporting in significant ways as well. So previously, in a community paper like mine, as well as news, obviously there would be lots of community events, there would be arts things that were happening, there would be sports. All of a sudden, with the restrictions that were put on because of COVID, things like arts events and sports events, they largely disappeared, and COVID took over. And it stayed that way for several months. Things have adapted now. Things are a little bit more normal, but it was a very strange sort of sudden change in what we were reporting on. I'm still on the COVID beat. I do still report on all of those other things like bears and mountain rescues and provincial elections, which we currently have going on here in British Columbia. I would say that about half to a third of my stories right now are COVID stories out of the total. BC is one of the areas in the country which is doing relatively well, although we are now into our second wave. Cases are going up, and there's lots of discussion about what the case numbers versus the hospitalization numbers mean. Definitely our pandemic is concentrated in the lower mainland of British Columbia, the area around Vancouver, and particularly in the Fraser Valley. I do watch the numbers quite carefully. North and West Vancouver have been among the communities that have had a higher incidence. I'm not sure exactly why that is. I would like to know more, and I can talk a little bit later about the difficulty of drilling down into some of that information. But you know, compared to many places in the world and many places in Canada, we're doing pretty well, but it continues to be a story that it really has occupied a very large space in my reporting, and a very large space in terms of what readers seem to want to be reading as well.
Well, thank you, Jane. That's a great introduction, and we look forward to drilling down a bit into that. I'd like to now introduce Jad Sharour. He is a journalist, civil society activist, and a communications officer at the Samir Kassir Foundation in Lebanon. His work revolves around using media to advance social cohesion, tolerance, and to defend freedom of expression and digital rights. In the aftermath of the devastating August 4th explosion in Beirut, he has helped the Samir Kassir Foundation launch the Media Recovery Fund, which aims to help the country's media workers access medical and psychosocial support, replace damaged equipment, and conduct robust investigative work. He joins us from Beirut. Good evening, Jad, and thank you for being here. I think that you're just on mute.
Sorry.
Thank you, Jad.
Thank you
Welcome.
very much for having me tonight. It's at Lebanon 8 p.m. I know it's 1 p.m. at Canada time. I'm very appreciated to meet all these experiences from around the world. Lebanon is a big word in the Middle East. Like if we're talking in the whole world about the era of high speed, we don't have technologies, but we have a lot of political events. So this kind of speed we have in our region. We, like 3 weeks ago, we used to be as journalists, activists, all the people in Lebanon are all the media is shedding lights on COVID-19 facts, numbers, best practices, what is going on with the hospitals and the people's homes, everything. Then it came the crime, 4th of August, the big explosion that till now there's no official answers what really happened. And people for 2 weeks, they didn't talk about COVID because there's a lot of death numbers, injuries, people without homes. Like if they are facing already COVID-19, now they are facing COVID-19 homeless. without work, without money, because we have a currency crisis. And now the media is shedding light on the government formation. So we have a lot of political events. COVID is one of it, but today it's not our top news. But, and if we are talking about health, it should be our top news, because till now we don't have in Lebanon like someone to trust when it comes to numbers, to facts, because we still believe that hospitals are being obliged to give serious sum of numbers for the Ministry of Health, and Ministry of Health is under the control of Hezbollah, one of the major faculties in Lebanon, and everyone knows Hezbollah is one of the most like controversial political party in the region, and a lot of questions around their work, what they do, and we are facing this too. So we have a lot of problems. COVID, sure, COVID is one of it, but now it's not our top news. But in the same time, what we need to talk about that even the media sector, who is really under the control of 12 political parties in Lebanon, because they hold this media, they have this, they are funding this media. So the content of this media is only the political stories of these families, not the real stories, not the real numbers, not the real facts about COVID and how we can protect us. More than that, that the journalists facing COVID bodies, because the media association didn't help really the journalists in funding them how to protect themselves, how to take like medical kits to go to the ground. They didn't protect them and going to the hospitals. They didn't give them open sources to have real facts, real numbers. And they one of the biggest problems in the very few earlier weeks of COVID, when it was really get on the Lebanese streets, is that the political static used the lockdown to as a tool of repression. In the first day, they prevented the journalists to go down to the streets, and then we raised our voices. How we can cover these stories if we don't have the permission as a journalists to go down to the streets, to ask the hospitals about numbers, best practices, to meet the people who should talk to the media about COVID-19. Till now, we're still facing such conflict about or these problems about covering COVID-19, but in the same time we have another struggle, which is the 4th of August explosion.
Well, thank you, Jad. And of course, our thoughts are with Lebanon because of that explosion, the aftermath of that explosion. I did, you had also mentioned numbers and that issue. I did check the World Health Organization's website today, and it says that there were 1,241 new cases of COVID-19 in Lebanon today, and a total now of 536 deaths. So I'd like to bring in Kiran Nazish. Kiran, thank you so much for joining us. Sorry for that trouble. Kiran got her start working for a newspaper in her native Pakistan at age 16. She has worked as a reporter in Afghanistan, Iraq, Syria, Turkey, Pakistan, covering terrorism, foreign policy, and conflict. In 2017, she founded the Coalition for Women in Journalism, which pioneered the first global mentorship program for mid-career women journalists. She is currently a distinguished visiting professor at Brandon University in Manitoba on the beautiful Canadian Prairie, and that's where she joins us from today. Welcome, Kiran.
It always happens, the mute, you know.
It happens to all of us. Thank you and welcome.
So thank you so much, and thank you for your patience as well. I think I logged in a different way, so it's on me. That also always happens, no matter how many times you do Zooms every day. So I think there's a lot that has happened during COVID, and as you know, I will speak a little bit about women journalists because our work focuses on how women reporters work. Our research focuses on that, as well as our networks are for women. However, to do this work, obviously we have to look at the entire landscape of journalism. So a lot of the trends that we're seeing does apply to the industry, but I'll tell you a little bit like the data and the other work that I will share will be focused on will reveal more about how women have been working on the front line. Regarding the mental health challenge, I know that today at this consortium, there will be conversations about safety and other aspects of this, so I'm not going to go into the details of that, but I think that talking about only of mental health, one of the reasons this event of COVID-19 and the spread of the virus and the lockdowns that followed the virus has really affected journalists in general and women reporters as well, is that there is an uncertainty of what is going to happen. And that uncertainty, journalists are human beings, and that uncertainty, whether it's political, whether it is about a disease, whether it's about being on the front line or losing a job, that uncertainty has really triggered a lot of mental health challenges. Some of them are not that severe, and sometimes we have also seen a lot of journalists reporting about panic attacks and those kind of things. Dr. Anthony Feinstein shared their research, which is really helpful as well to understand, how journalists are kind of facing this challenge. We don't have a lot of that work going on. But to begin, I would just say that when I think it was around mid-March, when during the spread of the COVID-19, we started documenting through our network how women reporters were on the front line. As the lockdowns were beginning, we were seeing all kinds of industries shutting down, which also meant for a lot of journalists working from home. So in the beginning, mid-March, late March, we're seeing that a lot of newsrooms were telling their reporters to work from home. And a lot of freelancers also were, trying to improvise. And I think at that time, we were thinking it's going to be a couple of weeks. We thought that it would go on till April. And by April, of course, we were very clear that this is going to go on for a long time. The lockdowns are going to prolong. So that one of the biggest challenges we saw was the financial challenge. A lot of journalists lost their jobs. Within our network as well, we've seen around 80% journalists lost their jobs either in the newsrooms. Some were in the newsrooms, and majority of them were freelancers. So these women reporters were reporting from everywhere. They are not able to continue their work. One major trend that happened almost everywhere around the world was that journalists were reporting on, say, education, health, culture, politics, and suddenly the entire beat became COVID. So on the one hand, we saw that journalists did not have opportunities, but on the other hand, we also saw that journalists were improvising. And they started working, changing the beat and, gaining new expertise and spending a lot more time on health and, going on the front line and reporting on COVID-19. So the two things I want to mention about mental health, because we're talking about the mind and how, it has affected journalists. There has been a lot of stress and anxiety being on the front line. The financial loss and the loss of job has really caused a lot of anxiety. I think that Dr. Anthony Feinstein mentioned that younger reporters are facing a lot of mental health issues, and I think that might be linked with the fact that younger reporters are facing uncertainty. because they have a future ahead and they don't know how long, if they can carry on in the industry or not. And that is true with a lot of women as well. Women, a lot of women have families. We saw that when women journalists were on the front line, one of the major concerns we saw was, of course, they had to prepare themselves, because in the beginning, newsrooms were not really prepared for it. It came after a month and a half that we started seeing journalism support organizations, and newsrooms preparing journalists to work on the front line. But in the beginning, there was a lot of preparation anxiety as well. Are we prepared? Journalists did not know enough about how they need to be prepared, what kind of mask to wear, where to get that mask, and so on. We still, I think just until a month ago, we were seeing a lot of reports of journalists connecting to us from different cities to understand where they can be tested, how they can travel, and airport regulations. A lot of our members are foreign correspondents, so traveling from one country to another, and planning your travels and your reporting according to the lockdowns, and aligning all of that. So these kind of challenges have been really present, and coming back to my previous point about the front lines, being on the front line, I think women journalists have, of course, had that preparation challenge, which has caused a lot of anxiety, not knowing what to do, and then improvising yourself. I think Jane mentioned some of the things as well. It's very important to understand that how an individual journalist would have to improvise, and I think a lot of times journalists, whether they were in the newsroom or they were freelancers, they kind of had to prepare themselves on their own and figure things out on their own. And one of the other things that we saw with women reporters that is still true is that when they're going on the front line and reporting from hospitals, or generally even on politics, going to press conferences, they come back home and they fear, bringing the virus with them. So we see a lot of women reporters having to limit themselves to their families. Recently, there was Thanksgiving in Canada, and a lot of reporters were thinking whether they should go, meet their family during that time. And so I think a lot of those things, our personal life as journalists, as well as the political situation in the country, has really affected COVID-19 and the ability of the industry to be prepared for this. I would say that one of the other most important thing that is true, and Jad was talking about Lebanon. A lot of our members are in Lebanon as well. We also work in the Middle East, so Turkey, Lebanon, Egypt, some of these countries, Pakistan, India. There are certain countries where we have seen an increase of violations against journalists and an increase of censorship during COVID. And like Jat mentioned also, we are seeing a very vivid increase, utilization of this opportunity by states that want to censor the press. So we see that governments and states and regimes that want to censor the press or spread misinformation, they really utilize this opportunity of the COVID-19 lockdowns to suppress people and not let journalists come out, or not let journalists have access to, say, the parliament, or be able to do their job on the front line, and be able to have access to hospitals and those kind of things. So we see a clear, there are so many incidents that we can, we don't have time to cover that, but
I hear that. I'd love to actually, if we can, I would love to start getting into sort of bringing in some other folks. I don't know if you have a closing thought you want to make right now.
Yes. Okay. So yes, I think I would just say that closing thought would be, I think that because of the heightened, everything has heightened during COVID-19, financial crisis for journalists, the press freedom challenges for journalists, and the spread of misinformation that has challenged journalists in a way that they are uncertain about whether they can do their job, whether they are financially stable or not, and whether they can carry on safely to be able to be there and do their job essentially. So that is something that has caused a lot of anxiety, as well as we are seeing an increase of panic attacks amongst journalists, and also a lot of mental health issues.
Thank you so much. And we've got such great context to start with from 4 points around the world. Anthony, one of the things that I picked up on what Kiran was saying was about like early in the pandemic when we didn't know how long this would be. And in fact, in April, you wrote a piece for the Globe in which you said journalists are highly resilient, but they are not immune from the emotional toll that comes with covering dangerous and traumatic events. In many parts of Canada and around the world, we are seeing that a second phase is upon us. So I wonder, what worries you most when you think about journalists who remain on the front lines of COVID reporting? And did my internet just cut out?
It did for a bit, but I think I've got the gist of the question.
Okay.
Yeah, thank you for that. I mean, if I could just follow up with something that Kiran said, which I think is so relevant. We now recognize, I think, that the predominant emotion with the pandemic is one of anxiety. And I think the reason for that is all the uncertainty. Kiran spoke to this. There are so many uncertain things. You wake up in the morning and aspects of our life that we take for granted are no longer there. We've just lost control. There's so much. We're uncertain about the infection rate and when we're going to get on top of it. We're uncertain about the economy, the unemployment. We're uncertain about whether we're going to get back to the office and whether there are going to be jobs for us. And so in the context of so much uncertainty and so much loss of control, it's understandable why people are becoming anxious. In fact, they were anxious from the very beginning. I think we kind of entered a different phase now. The emergency rooms aren't crowded with COVID patients, at least not yet. In our hospital, the wards are not full the way they were with COVID patients a few months back. That may still be coming because of the second wave. But I think what they realize now is that the risk of infection is of course still there. It hasn't gone, but we're in it for the long haul. There's a sense of exhaustion, a sense of fatigue, of how are we going to sustain our energy for what clearly is a long and difficult story, and it's going to be around for a long time. And it becomes very difficult to do that if you're focused on the uncertainty and the things that you can't control. And I think this is a really important therapeutic point, because I put it across in the sessions that I do with news organizations, that at a time like this, you've got to avoid what we call catastrophic thinking, in which one negative thought slips into the next one, in which you're focused on those things that you can't control. And you have to recognize now that it is a period of uncertainty, that many of the variables that create this uncertainty are beyond our control, and that if you're going to devote your emotional resources to focusing on that, you will become exhausted and dispirited, and you won't have the stamina and the endurance to keep your emotional equilibrium through what is going to be a very long and difficult winter. And so the antidote to that is to shift your thinking towards those things in your life that you can control, the small aspects of your day-to-day existence that you can still control. And it sounds simplistic to say this, but you can control things like your sleep and what you eat and your social contacts and the importance of staying in contact with people, because we know that relationships nourish us, they support us, that good connections are important for our mental well-being. And if you're going to be distant from people and you can't go into the bureau and you can't see your colleagues and you don't have that usual level of contact with individuals, it's quite easy to lose touch with people. You can kind of withdraw into this very small, isolated world, and that's not good. You can control that. You can make a conscious effort not to do that. You can also control things like, well, I'm going to do a bit of exercise. I'm still going to remain physically active. And most importantly, we come to this concept that we call respite as a form of resilience. And that's not my terminology, but I think it's absolutely key. Respite as a form of resilience. And what do I mean by that? It's that you cannot spend all your energy and your time focusing on the pandemic and the things that you can't control. You've got to build into your life, if you haven't done it already, those things that nourish you, that are separate from all this uncertainty. Your social contacts, your hobbies, your interests, your family, going for a walk, those kind of things that separate you from the intensity of the moment. And it's essential that you do that. And that's my message to journalists. In fact, it's my message to society in general, but it's, we're talking about journalists over here, that you want your moments of respite. They've never been more important. And as the world shrinks around you and becomes much smaller, those quiet moments of respite, those moments in which you are with yourself doing something that you enjoy doing, take on an added significance and an added importance.
I just quickly, Dr. Feinstein, I wanted to ask, you talked about control. Do you think that that is one of the reasons why we have seen this trend that people are baking sourdough bread? Is it this idea that, you know, we have something to take care of, we have something that it sort of keeps us on a schedule? I'm not doing it, but my friends are, and I see that there's so much care taken. But would you say that that is actually maybe what's happening?
Yes, absolutely. That is your moment of respite. So people are looking for things to do that they can still do, they can still control, they learn a new skill, they can make some dough, they start, I'm the same as you, friends are suddenly giving me their bread,
I welcome it. I welcome
it. My entire life, I've never been offered bread, but suddenly people are baking. And yes, so these are these moments of respite that build resilience, and they're very, very important.
Okay, well, thank you for sharing that. Jane, I want to, you referenced this, but I was hoping that you would talk more about it. You talked about covering that first COVID-19 death back in March. It was on March 8th. And as I mentioned, you did actually speak to the daughter of the man who died. And so I wonder if you could, for a couple of minutes, take us back to that day. How did you approach that story? And what was going through your mind when you filed it?
Well, it all happened very, very quickly. So it wasn't as though I or actually anybody else on that beat had time to think a lot about, how we were going to approach it and sort of craft it really. Basically, on that particular day, I found myself on the phone to this woman who she was very gracious in the midst of a scary situation. She actually wanted to thank some of the healthcare workers who had been there for her dad in those final couple of days, and that's sort of why she was willing to talk. But obviously in the course of that conversation she did talk about the situation that she had encountered at the care center. And that's actually one of the things that I experienced in reporting on the story, was that it was people like the families who have been impacted by COVID-19 and the healthcare workers who have dealt with it and been working around it, who have really provided us with our window into the situation. My experience and that of a number of my colleagues has been that official information has been somewhat difficult to come by, or at times hasn't been 100% accurate, shall we say. In the early days of the Lynn Valley Care Center outbreak, definitely we were being told that there was an outbreak there, and obviously health officials were very concerned about it and were expressing that. We were also being told at various points that things were under control, that they had a plan, that they, it was being handled. But we were also receiving phone calls and emails and texts from family members who actually had been inside the care center to see their loved ones, who were telling us, no, that's not the situation. It's not under control. There's hardly any staff here. Nobody's feeding these people. Nobody's, attending to their basic personal care needs. Medication isn't getting to them. Now, obviously, that situation was resolved, but there was a period of time where things were quite concerning and quite dire. I managed to speak to a number of family members. They were actually all daughters of people who were in Lynn Valley Care Center. And they came to me a couple of months after the crisis had really hit. And they wanted to share their stories about what they had seen and experienced inside. And one woman, her mother had died of COVID-19 in Lynn Valley Care Center. And they were amazingly gracious and generous with what they were willing to share. And what they talked about really highlighted the fact that there had been a problem in care centers for a long time beforehand in terms of how much funding there was, in terms of the sorts of staffing that was happening. But we didn't really see it before the pandemic because it's not a sexy topic. It's not something, you know, that tends to win votes. It's not something that you even necessarily see unless you have a family member who's experiencing it. And by that time, you're in the thick of it, and probably, you know, alerting the public isn't the first priority for you. In fact, there had been reports on the situation that had been going out for a number of years. In BC, we have a seniors advocate, and she had been writing, raising the alarm about the situation for a number of years. And there had been small incremental changes that were happening. But I think that the pandemic really focused attention on the situation of our long-term care homes, and in terms of how the situation had even developed to begin with, which is complicated, but has a lot to do with government priorities and resources and money, and the fact that we tend not to see people when they're old. So all of these things, it made for a very interesting story. It was a very heartbreaking story. And I think it really highlighted the willingness for just ordinary people to come forward and share their experiences, and how important that was to covering this story, and remains so today.
Thank you so much for sharing it. It sounds like the kind of stories that we're talking about that stay with you and that are difficult to report. Jad, you have already referenced the situation in Lebanon on August 4th. For folks who I'll just remind folks, this was a catastrophic explosion in the port that left more than 200 people dead, 6,500 people wounded, and 300,000 people homeless. On any given day, this story of this magnitude would be it would be such a challenge to cover. But to cover that in amidst the political and economic turmoil of the country and a global pandemic, I wonder if you can just shed some light on how have journalists managed to cover both stories simultaneously, especially given, you know, some of them, as you shared with me previously, have lost their homes or their cars or their equipment. How have they managed to do this?
It's not a joke, but really how to describe how Lebanese journalists are working nowadays with these all political events. I would say that if there's a Hollywood production and they're looking for new heroes for Marvel, then the perfect cast would be the Lebanese journalists, because of the huge amount of the political events. Like 1 week, you would have that your top news is you're going back to your home, a huge explosion. Take your home, take your equipment, your car, your relatives, your colleagues, and you need to cover all that. You to take the picture and send it to the public. You need to talk about it. So you need to be a robot. You need to put your feelings aside and to work ethically to cover all these events, to raise awareness to people what to do and what not to do, how to protect themselves, what should they do. And we believe that if there's a free media, then there will be, like, how to say it, like people would be more protected. That, like, I can say that free media would save lives. But in Lebanon, we don't have this kind of freedom. We don't have the luxury of freedom because of the political system, the sectarian system, the political and the economical situation. Journalists should face all these. So what we at the Samir Kassir Foundation, we said the words that the state would not ever and never say it for journalists. We said that we are your backup. We ran the biggest initiative for trauma and psychosocial support, the equipment placement, the work environment, and we go far to support with the aspects of the technical and developing tools for investigative work. We said that if you are and you want to shed light on some matters and you think as to help you with that, we will fund that report. Give us the information. We will hire for you graphic designers, videographers, equipment, logistics, anything, and we will support you because we believe in free journalism and we want to raise the scene in Lebanon. We cannot live anymore with this political, and the only tool that we should work on it nowadays is to raise awareness on our freedom of expression, raise awareness on freedom, on press freedom.
Okay. Thank you so much. And it seems like we're having a little bit of technical difficulty, but I really appreciate what you're sharing, and particularly the information about the media, the relief fund that your organization has set up, which I will share a link for. I wanted to bring in Kiran. You had talked about the fact that you raised the notion of disinformation, and I wanted to say, reporting on something as complex as COVID-19 is difficult enough. And we've heard Jane and others say people who aren't health and science reporters find themselves now covering a very complicated story. But many journalists are also battling rampant mis and disinformation and about the virus, some of which is coming from political leaders. And so I'm wondering, from your perspective, Kiran, what additional burden is this disinformation and dealing with it placing on journalists? I think you're on mute. Sorry.
Sorry, sorry about that.
No problem.
I would say great burden and multitudes of layers of burdens. I think that post COVID-19 world is different. The world has already changed with COVID-19 and how it has interacted with different elements of our society and civic life. I would say that there's one distinction I wanted to make, which I think is important, is that the lockdown, especially with COVID-19 and the anxiety and social anxiety and trauma of the spread of the virus, largely in society, essentially has changed the way journalism essentially works, but also how we respond to, we are going to respond to the changes in the world. I guess what I wanted to say is that different countries are going to experience a heightened form of what they already were. So in the West, for example, in the US, Canada, Europe, European countries, we see a different tendency of how COVID-19 affected journalism and journalists and their ability to do their work. A lot of the focus was on being able to deliver information. So the way journalists were working was still they had access to hospitals, they were still able to report, and how COVID-19 affected them was more about safety, about personal well-being and anxiety and those kind of things. But there are certain parts of the world where, like Lebanon, Egypt, Pakistan, India, Mexico, a lot of countries where we have Eastern Europe, Belarus, Hungary, all of these countries that I'm naming, something different has happened after COVID-19, and that is the heightened political tensions in these countries. Governments and regimes have taken the opportunity of the lockdown and then done a lot of different kinds of things. So in that part, in different parts of the world, we're also seeing that journalists are facing the challenge of not worrying about the virus and not caring so much about COVID-19 and not even reporting on it. A lot of our members in Pakistan, India, Mexico, who have contracted the virus as well. So journalists are on the front line, and they're also, they have two women reporters died of COVID-19 after contracting the virus. They were both senior. And we saw a lot of older women reporters afraid of going on the front line as well, even though some of them still had to. A veteran correspondent, Debbie Nason, who works on the Mexico-US border, she's covering this tension. So on the one hand, the journalist has to cover the tension. So if I give Debbie's example, she's on the border, she's covering the tension between ICE, at ICE detention centers, where you have all those kind of the story, the concerns on that story where people are in detention centers contracting virus, and she's trying to do her job. She's over 60 and she's worried about her health. So there's a lot of that journalists have had to face because they're covering very difficult stories. In Lebanon, 12 of our members were injured during the explosion at the port, and almost, I think, all journalists were affected in some way because of the explosion. Their houses were damaged and all that, and they had physical injuries. So physical injuries on top of the mental stress of being in the middle of a political crisis. I want to say that in a lot of parts of the world, journalists are not able to focus on COVID-19 as a disease. And so one example again of Lebanon I'd give, so that it's more contextual, because Jad is here as well, is that journalists on the one hand are covering the political crisis, and on the other hand, we're seeing this increasing number of COVID cases at the hospitals. So in Lebanon, hospitals are reporting an increase of the virus, but we don't have the attention in the media to be able to cover that because there's a great political crisis going on. So there's these things, and I just want to say that in the end, I just want to say that there are places where journalists don't have the time to have panic attacks. And I really mean it. I think journalists are really busy covering the political crises of what their governments are doing, and being censored, and then also trying to combat misinformation while trying to do their job and taking care of their families. So what I think is going to happen is, after COVID-19 and how we see maybe in the next year, after summer 2021, we would see what would happen to journalists and how they are going to process the result of this, because of course this trauma that they're suppressing, this happens to war correspondents as well. When we are on the front line, we ignore the trauma, and then we come back to a safe space, and then we have our panic attacks. I've been a war correspondent myself, and I would say that usually it happens afterwards. So I think that we do see that there's going to be a greater challenge after we surpass this time, and then we would have to be prepared for that.
Thank you. Well, I think I want to bring in Anthony again. One thing that Jad said to me that stuck out was this idea of people putting their feelings aside, and I wonder, because we've also got a question in the chat, so I'm going to sort of combine two questions. So I wanted to ask you, I think you've outlined already what reporters might do to maintain and promote their own mental wellness. This idea of sleeping, eating, social contact. I love the idea of respite as a form of resilience. But how might and what should news managers and news outlets do to actively support this? What is the responsibility of the employer here in these situations to support people? And then going to a question from the chat, which is, I guess it was also like, what tips do you have for journalists when they become overwhelmed with their coverage? But maybe first to you, what responsibility do you think employers have in this, Dr. Feinstein?
So I think they've got a very big responsibility. I think they've got a moral responsibility to look out for their journalists. I think if you're going to ask your men and women to take on a demanding, potentially dangerous and risky job, then you've got to basically ensure that you've got resources to help them should they need it. So I believe very passionately in this. There's a moral responsibility on the part of news organizations and managers to look after their physical well-being of their staff, but their psychological well-being as well. I believe at the end of the day, the greatest source of disability from the pandemic will probably end up being psychological disability, the mental effects of the pandemic and what it's done to our society. And we see this all the time in organizations. And so I think there's some simple steps. I mean, our data show quite compellingly that those organizations that provided psychological support through some time-limited counseling to their staff make a very real difference. The journalists who took up the counseling, who went for it, show significantly less anxiety, less depression, less PTSD, less feelings of psychological distress. I mean, counseling works, it helps. And, I'm not advocating in-depth, lengthy therapy. This is practical, supportive steps to help journalists doing very difficult work. And the data show that this can be helpful. So I think news organizations have to have that. That's a basic standard of care right now for journalists. You can no longer close your eyes to this. People have always created this dichotomy between physical illness and psychological illness. Somehow it's different. And my argument to news organizations is this: and if a journalist breaks their leg, you don't tell them to suck it up. You go along to hospital and you get your broken leg attended to. So when you come to psychological difficulties, why would you not approach it with the same level of attention and care? You don't have this attitude that, suck it up and deal with it and show the right stuff. You've got to be sensitive to these emotional factors. It's not only good for the journalist, it's actually good for the news organization. News organizations don't want unhealthy people working for them. You don't want to have a staff that's anxious or dispirited or despondent or depressed. It's in your best interest to make sure that this doesn't happen. And so by paying, careful attention to mental health, it's good for everyone. There are no losers in this. And the other point is that, and I say this all the time, mental health is not expensive therapy. It's not costly like MRIs or surgery. It's really, it's a cheaper form of medicine. You just want someone there who's skilled that you can talk to, who can offer you the right kind of assistance. And so, it's really a no-brainer to make this available to the journalists who are doing this kind of work. The question that was asked online, I can come back to this in a moment if you want me to address that, or I can do it now.
No, please, go ahead, sir.
Yeah. So the question was, how do we manage our distress? How do we manage all this uncertainty? And the basic principles are these. You don't want to focus on all those things that you can't control. Since the pandemic has started, we have lost control of so many aspects of our lives. And if that's where you're going to focus on, you will become exhausted because you will not change that. You will not shift the needle. This is going to be there. It's going to be there for many months. You have to focus and put your energies into those things that you can control. Small things like your sleep, your appetite, your exercise, your social contacts, your moments of respite as a form of resilience. And you do that through planning and structure and repetition. So plan your lives. As journalists, you are very effective at doing things. You've been effective in your careers. You've made a success of your career. So use some of those skills that you've acquired and apply them to yourself. And plan things. Sit down and think about, what do I need to do? Write out what your plan is going to be. What I tell journalists, when you start the day each morning, have a blank piece of paper in front of you and write out on the piece of paper a couple things that are going to be your moments of respite during the day. And I think it's imperative that news organizations allow journalists to step back from their work, from the intensity of the story, and say, devote some time to your well-being. Good organizations recognize that. We don't want you working 20-hour days, day after day after day. Step back from the intensity of the story, which comes with so much emotional baggage, and devote some time to yourself and some time to your family. And remember this, that although the pandemic is this all-encompassing, embracing story, life goes on outside of the pandemic. You've got to look after your home, you've got to look after your children, you've got to do the shopping, you've got to make sure that your appliances are working. You've got to make sure that the basic building blocks of life are not left unattended, because that falls apart. And if that falls apart, it becomes so much more difficult. And that's why my sympathies and my heart go out to people, Lebanese journalists who are having to do all of this in the context of this tremendous explosion that has shattered aspects of their daily life. I was asked to speak to a journalist in the immediate aftermath of the bombing in Beirut, and she had lost her apartment and she had been wounded. And she went along to the local hospital where the focus was not on COVID anymore. You had to attend to all these wounded people. And so the kinds of barriers that we have in place in Canada, where you go into a hospital with social distancing and all the kinds of basic things that public health tell us to do for the pandemic, were just not in place in Beirut because of the magnitude of what had happened with the explosion. And so the level of stress in situations like that is extraordinary, far beyond what we have to deal with in Canada, where the stress is considerable anyway. So there are multiple things that need to be considered over here.
Thank you, Anthony. Very, very helpful. I have found, nature we've seen people, for instance, take up birding, for instance. Like, I think the reminder that life goes on, to have a moment of, as you say, respite, where the leaves change color. And in Eastern Canada, we've seen a beautiful season this year of leaves changing color, and that sort of grounds you, that reminds you that life does go on beyond this big story. Jane, it's been brought up a couple times, but the news business had fallen on quite hard times even before the global pandemic was declared on March 11th. But it's only become worse as newspapers or magazines cut back production, lay off journalists, cut pay. And these austerity measures are another burden that journalists are dealing with. And I wonder how this has played out in your newsroom. And I know that in preparation for this panel, you also reached out to some colleagues in Vancouver. So I'd be keen to hear what they also said about how the austerity related to the pandemic is making the job of a journalist even harder right now. And then that bearing on their minds as they go about the work and this uncertainty.
Sure. Well, it is true that news organizations in Canada, although we certainly aren't facing the sorts of situations that I hear people like Jad talking about by any means, we've been facing challenges for a number of years in terms of competition from things like Facebook and aggregator sites, and sort of the rise of internet media and the pressures on traditional media. So media have been struggling for a while, and when COVID hit, it definitely put huge stresses on the news business here. Their revenues plummeted, because basically large chunks of the economy were shut down, and that had a direct impact on advertising, which of course funds our media. So we did see a fairly immediate impact. This was throughout Canada, throughout Metro Vancouver that I'm most familiar with. Numerous news organizations faced layoffs and wage rollbacks. Some newspapers closed entirely, and they haven't come back. We had layoffs in my own newsroom. And these are people who are senior reporters with a depth of knowledge in the community, and they're not there anymore to bring their their knowledge to the stories that we're trying to tell. Luckily, we have been able to bring one reporter, a different reporter, back through some government assistance, actually, which has helped. I think that journalists are feeling they're having to do a lot more work with a lot fewer resources, basically, and there's a sense of trying to cover an enormous story and not having the resources to do it, and also COVID has sort of sucked all the air out of the room. So there's other really important stories out there that we all know we should be getting to, and we all feel guilty that we're not getting to, but there's only so many of us and so many hours a day. So the pressures that COVID and other factors have brought on news organizations have definitely impacted the newsrooms.
Thank you very much for those insights. I am glad to hear you say that at least one of the positions that was discontinued at your news organization has been refilled by someone. Jad, I was hoping to bring you in here. One of the pillars of your foundation's Media Recovery Fund, which you've talked about, is trauma and psychosocial support for journalists. And as we know, thanks to the work of Dr. Feinstein and others, including the DART Institute, there has been growing aware of the need for this. But I wonder, how attuned to this phenomenon are journalists and media outlets in Lebanon? Are there barriers in Lebanon that might prevent a journalist who is struggling from seeking help, from seeking this psychosocial help that you hope to offer through the Recovery Fund?
Actually, the 6 pillars I mentioned in our Media Recovery Fund, we communicated the pillars in a way to let everyone who wants to join this recovery fund or to get benefit of one of the pillars to get it privately. So it's a private application that he can go into form and apply for the form privately without sharing the information, without sharing who did participated in that specific pillar, whether it's about the medical support or the trauma and the psychotherapist support. So first of all, we made sure that this is private and we will not talk about it. And every journalist, we are trying to encourage journalists to join this, to get benefit of this initiative, because we believe that they might be shy to join the medical support or the psychological treatment or something for that. And actually, I'm very happy to meet Professor Anthony, because in our website we did publish in Arabic some of his best practices through several articles or interviews he did. We have his recommendation in our website, and in English and in Arabic.
That's a great connection. I'm so glad to hear
Yes,
that
I'm
that's
happy
happened.
to meet him in the conference. So we were trying to promote such information, such as the information of Professor Anthony that he's provided. Thank him, and thank you very much for sharing such a good and supportive information, because we believe if we connected such information to the Lebanese journalists, they would be more encouraged to join to talk about the trauma.
Thank you so much, Jad. Kiran, there's a question in the chat that I was thinking that I would put to you, and it is, what is the most valuable thing that journalists can learn about journalism and story coverage from covering this pandemic? Mute. Oh, mute.
I gotta not put me on mute again. Okay. So I think that that's a very good question. Because the pandemic has changed so much around the world, right? I think that one thing that journalists and the industry has really learned from this pandemic is that anything can happen anytime, and that we are not prepared, but we should be prepared. Whether it is the spread of COVID-19 and the lockdowns that happened and how journalists had to improvise suddenly, newsrooms as well as freelancers, that it was sudden and we were not prepared to respond to that sudden. Something unknown can happen. And I think journalists generally, especially foreign correspondents, are more prepared for that. And we saw in our networks as well, we saw that foreign correspondents or journalists who are covering different cities, like say freelancers who are covering different parts of a certain country, they were able to respond more quickly. And if they were, say, covering Health Week, they were able to go back and change the beat and cover COVID-19 more quickly. Most of the foreign correspondents and war correspondents have been able to still cover COVID-19 as well as simultaneously cover political crises. And that is probably linked to the preparedness element that I think that journalists who are used to covering new beats and going to new places and preparing themselves, they were quickly able to respond and equip themselves and as well, even while, we were still going through confusion about what to do, how to keep yourself safe and all that. Because there was a lot of lack of information, confusion about how journalists can go and cover. A lot of newsrooms in the beginning were resistant of sending reporters to cover, especially in the Western countries. And in some parts of the world, we see that newsrooms are deliberately sending reporters, especially asking freelancers to go without equipment and resources. So I think that preparedness is something that is very visible, that as an industry, we need to ask ourselves, anything can happen. Political turmoils can happen anytime. Health crises can happen anytime. Are we prepared to improvise, and be able to still do our job? I do think that a lot of, depending on the experience of organizations, we've also noticed that news organizations that have been more equipped to work in diverse areas were able to quickly respond as well. They quickly went online, or were able to introduce technology to keep their reporters connected and safe. There are a few things that we learned in terms of mental health, again, comes back to preparedness, is that when we created, when the COVID-19 happened, we launched a map, and the map on our website, you can see it on our COVID-19 in focus page, which is at womeninjournalism.org. We have a map that shows women journalists reporting from different parts of the world who are on the front line reporting on COVID-19. And what we did is that we also connected a lot of reporters regionally as well as globally. And through these connections, we were able to bring reporters to share advice and what they were doing on the ground and how they were staying safe on the ground. And that being connected with other reporters not only helped with information and logistical information, being able to share resources and advice, but also worked as a great support system for women reporters who were facing anxiety. And I do want to say that, one, I think, like Dr. Anthony Feinstein mentioned about newsrooms need to have mental health support. We've done a lot of new things in the industry. We started having journalism unions when we saw labor issues inside of newsrooms. We're, historically in journalism as an industry, we introduced HEFAT training for reporters who were on the front line when reporters were going and covering wars. And I think now we are at a time where every newsroom needs to have mental health support, and journalism unions need to have mental health supports for freelancers. Press clubs need to have mental health support resources for freelancers. I think all journalists around the world are working in very precarious environments, and we need to be equipped to support them. Otherwise, I think it's really half-half. Journalists who don't have mental health support cannot do their job, properly. But one other thing I wanted to mention, that the reality of the industry is that journalism is going through a financial crisis as well. The business model is not really working, especially combined that when in a lot of parts of the world where there are political regimes trying to censor and spread misinformation. The reality is that journalism is suffering because of that as well, and there's a financial crisis. So on the ground, a reporter, whether it's a freelancer or a staff reporter, they maybe in a lot of countries cannot have access to mental health support and cannot afford doctors. We work on this every day. We offer mental health support to reporters. Sometimes these are pro bono and sometimes they are paid, but we are always out of resources. So what do you do in that situation where a reporter cannot access mental health support or therapy? I think that one other alternative that really comes into play that we have seen in the last few years in the Coalition for Women in Journalism is support networks that women journalists or journalists in general, they need to be connected to each other and be able to support each other as well. Because that being able, at the end of the day, it's about being able to share your stress, trauma, anxiety, creativity challenges. Your moral injury is a huge part of not being able to cover the story that a lot of journalists are facing right now. That when journalists have someone to talk to and a mentor or someone to connect with to be able to express themselves about their challenges in the field or in their personal lives or both, they will be in a much better place to be able to do their job as well.
Okay, thank you so much. So we have about 3 minutes left. I'm going to try to do something very quickly here. One, this just picks up on a last point that we just heard about newsroom resources that Kiran was making. And maybe we can just like a thumbs up or thumbs down, but do we think that the industry's resources availability and trying to do everything with limited resources will continue, or will we see reinvestment in newsrooms to ensure staff don't burn out? Are we going to continue to see resource cuts because the industry's bottom line has been so hard hit, or might this be a time for reinvestment given that staffs are burned out? What do folks think quickly? And then I want to go to one final wrap-up question for everyone.
If I could pitch in, I would say I think it's both. I think depending on the place and the country, and I do want to say I think journalism today is because we're looking at different parts of the world. So I do want to say that journalism is going to be the way the country, any given country is going to be, the journalism industry is going to get affected in that way. So I think that in some countries, we are seeing a lot of collaboration between organizations. Journalism inherently is a competitive industry, but we're seeing that now with COVID-19, a lot of political crises and censorship, we're seeing journalism as an industry is coming together. And so there's a lot more connectivity and resources. People are aware and willing to fund good journalism, but in some parts of the world, I think it's still going to be a challenge.
Jane, in BC, do you think that we're going to see news organizations level up and put in more money, or are you worried that it's going to continue to slide?
Well, I at this point, I don't think many news organizations have more money to put in. So that's, of course, a big problem. I don't think we'll really know until after after we see the end of this pandemic, what's going to happen. I know there isn't a lot of spare cash to go around, or actually any cash to go around. I think that when people see journalists being able to do more with less, that tends to be a situation that they want to continue, but there are limits to that. You have limited ability to keep and attract good people if you can't have decent working conditions. And I think that obviously all news organizations are really desperately looking for a new business model that works, because the situation we're in right now isn't sustainable.
Thank you. Before we go, I have one last question that I would like to put to each of you, and we might have to sort of think of like 1 minute answers, but it was a line from Jane's story on March 9th where she interviewed the daughter of the first Canadian who died of COVID, and there was a line that struck me. That daughter said, "The goodness in people isn't forgotten in this. The little acts of kindness are everything." And so this afternoon we have covered some difficult terrain. So if it's possible, I'd love to conclude on a hopeful note. As you four think about journalists working tirelessly to cover this pandemic, oftentimes under less than ideal circumstances, what has given you a moment of pause and hope?
Well, could I start?
Please do. Thank you.
We are an adaptable species. That's why we have survived to the 21st century. We've learned how to adapt through crises, and we will do that here. And while I'm aware of all the loss and the suffering which surrounds us, I'm also aware of people's creativity and adaptability and how things are changing. And when the dust settles and we emerge from this, this long dark period in our history, we will come into a different world. We will be doing certain things that are different, that are better. I see aspects of my clinical practice that have improved. We've learned to perfect virtual connection. I see how my patients with neurological disability, in fact, prefer working remotely, seeing me remotely. They don't have to come into hospital. They don't have to navigate traffic or spend a lot of money on parking or walk down long, horrible, long hospital corridors. So the model of medical care is going to change in some ways for the better. And so, amidst all of this trauma, we see things evolving in a positive way, because that's who we are as a species. That's how we've survived. And I see this all around me. I see creativity that will, transform medical practice in many ways for the better.
Thank you. Creativity. Okay. I see you, Kiran, nodding. Would you like to go next?
I just wanted to say thank you. That's a great point. And because at the end of the day, I'll just quickly say it because I don't want to take too much time. One of the things that we also saw was that journalists were resilient and they were creative. They were constantly thinking. Almost all reporters in any part of the world, journalists were constantly thinking during this crisis, and they have really come back. I think in the last few months, journalists have come back to improvise and find ways, alternative ways to be able to survive and do new things. And we have seen that generally in industry systematically as well. There's a lot more creativity. Creativity, in fact, is one of the things I had noted down. I didn't have time to go into it, but there are several examples of how we have also seen at the one side, we've seen a lot of mental health issue and trauma and panic attacks and anxiety and financial crises. But one of the most beautiful things is that we've seen journalists coming out creatively and doing new things and finding new ways and connecting to their work in a new way. And so that's certainly something that I think we will be able to learn new lessons and be able to improvise and do something good out of this as well, crisis.
Thank you, Kiran. Jad, obviously unspeakably difficult times in Lebanon, but I wonder if there has, when you think about journalists and the work that they've done, you called them superheroes earlier, is that what gives you hope, or is there something that gives you hope?
Do you know what, Matthew? I was very moved. Like, I had a lot of feelings when you read the sentence from Jane's article, because for me, maybe for the public or for the attendees, they are just watching or listening to different experiments or experiences, talking about what kind of struggles and crises that the journalism in the world is facing now. But for me, this one of the best trauma like treatment for me. Just sharing my feelings, sharing my experience in Lebanon with another journalist at the other side of the earth. It's one of the greatest treatment for us in Lebanon. And for me, maybe yes, I was just sharing what is happening in Lebanon, but it's for me, it's like a medical treatment, and I need to talk about it, and I need to raise the voice to let all the world to know about it, because this is the only way to get rid of this and to face such a struggle, is to talk about it, to move the picture to take it from the local to the public, to the regional, to the world, and to let the people to know that they are not only by themselves facing such a struggle. It makes me sad that we are in this situation, but it makes me happy, or it not happy, sorry, it gives me some kind of support to know that some of my troubles are in common with what Kiran said and what Jane said, and to re-watch or to meet Professor Anthony, because I already tried to read his comments on how to protect our mental health, and to find it on our website and to translate it into Arabic. And now I'm discussing it with him live with you and the attendees. I think it's a very productive experience for me. And I think it's one of the most wonderful moments for me to talk about what we are facing in Lebanon.
And thank you for sharing that. Hearing you speak reminded me of a lyric by a Canadian singer called Bruce Cockburn that goes, "You have to kick at the darkness till it bleeds daylight." And so this idea of talking about it. Jane, maybe we'll close with you. What is your moment out there in British Columbia?
Well, one thing that this whole crazy situation has brought home to me is that journalism matters and news matters. I think we've seen, hopeful signs in the community in general, in terms of their ability to step up and help one another, their ability to adapt. We've also seen people coming forward to help journalists. We actually, when the whole thing hit, we had a voluntary subscription drive, and we did have readers step up and offer money to keep us going until we could sort of get back on our feet. And I found a high level of engagement with the public and with readers and with people who are keen to get information and to help us get information, actually. And that has been really, really heartening to experience. I was having trouble with some freedom of information requests, and I was conversing with a woman who was talking about a totally different topic. And she said, "Well, I'm a lawyer and I deal with that. Maybe I can help you out." And things like that have been happening during this strange pandemic. And people really wanted the information. They wanted to know what was going on in their community, in their country, in the rest of the world, and they were hungry for it, and they were depending on us to find out that information for them, and they still are. We all get regular texts, emails, messages saying, "Hey, can you ask this question?" or "I want to know this." And it really it makes me hopeful about our profession in terms of its importance. One of the things that I like to try and do, and I know that others do as well, is to acknowledge when people have been doing really good work. If I read a story that I think is amazing, I try to let that writer know, because I know how hard it is to do our work. And I think it's really important for us to acknowledge that and to support each other as well.
Well, we kept folks a little more than 2:30, but I think that last moment in particular, this has been a really beautiful way to wrap up. So Dr. Anthony Feinstein, Kiran Nazish, Jad Shahrur, and Jane Said, I thank you so much for joining us today. I thank you for the work that you do and you will continue to do. And we benefit so much from your wisdom today. All the best to you all.
Thank you.
Yeah, thank you. Bye-bye, everyone.
Bye-bye.